Hi, my name is Alyssa Benoli, and I'll be presenting my Focus Guided Assessment presentation on the Philadelphia, PA 19133 community, focusing on youth and childhood obesity. This assessment will focus on the youth population within the 19133 section of Philadelphia, PA, and address the health issue of childhood obesity. Data was extracted from a windshield survey, demographics, census data, and explore the 6 dimensions of dimensions model of community health nursing. Geographic community and the physical environment. The community is populated by 26,063 people at 20,038 people per square mile. The majority of houses were built before 1939, and only 8,732 out of the 10,227 housing units are occupied. A high risk for lead exposure in Philadelphia is found in 13% of all housing units, with 22% of these houses found in areas suffering from poverty. According to Zillow.com, the median home price in Philadelphia is $146,200. However, the median home price in the 19133 zip code in Philadelphia is only $54,800. Dimensions model of community health nursing applied to the youth within Philadelphia, PA 19133, with a focus on childhood obesity. Biological determinants of youth wellness. The community is made up of 9,218 people under the age of 19 years old, with 4,662 males and 4,665 females. The population is split into 2 races or ethnicities, Black or African American making up 34.61% and Hispanics making up 61.54% of the population. Age-specific leading causes of death in Philadelphia are perinatal conditions and congenital abnormalities for ages 0 to 9 at 60%, homicide for ages 10 to 19 at 47%, homicide for ages 20 to 29 at 36%, accidents for ages 30 to 39 at 30%, heart disease for ages 40 to 49 at 19%, heart disease for ages 50 to 79 at 23%, and cancer for ages 80 and older at 28%. The immunization rate in the community for children between the ages of 19 and 35 months old is 75.8%. Health concerns for non-Hispanic Blacks and African Americans include obesity in young females, adult obesity rates, hypertension, diabetes, early heart disease deaths, new HIV diagnosis, teen gonorrhea and chlamydia rates, infant mortality rates, low birth weights, smoking, childhood asthma rates, elevated lead levels, homicide mortality and firearm homicides, education levels and reading levels, unemployment rates, and access to healthy foods and recreational facilities. Health concerns for Hispanics include low reading and education levels, childhood obesity among boys, teen births, access to medical care and health insurance, and adult and teen mental health. Psychological determinants of youth wellness. The community found in the 19133 zip code is exposed to high levels of violence and trauma, live in poverty, and 50% of all households are single guardian households. Poverty comes with higher rates of mental illness. Mental illnesses were more severe, lasted longer, and had worse outcomes. More than 45% of the population is living below the line of poverty. Mothers under the age of 18 within the community have a higher infant mortality rate than the average number taken from health clinics in the city, and 52.38% of the population seen at the local health clinic between the ages of 15 to 24 were murdered. Annual reported violent crime rates from districts within the zip code boundaries are the 22nd district with 1,507 reported violent crimes, the 25th district with 1,479 reported violent crimes, and 26th district with 691 reported violent crimes. Sociocultural determinants of youth wellness. Black or African Americans make up 34.61% of the population, and Hispanics make up 61.54%. The two primary languages spoken are Spanish at 47.9% and English at 50.6%. Disparities regarding healthcare treatment have been acknowledged within minority communities that involve access to healthcare, provider ignorance, and bias. The median household income is under $20,000 with an unemployment rate of 7.54%. The leading employers are private employers in healthcare and social assistance, educational services, accommodation and food services, construction, and wholesale trade. 43.3% of community members over the age of 25 have a high school diploma or less. This community has less than the national average of community members who attend college. Reading proficiency in Philadelphia is lowest among non-Hispanic blacks and Hispanic children. According to an article written in 2016, at least 241 homeless were found in Kensington alone. Nearby resources observed are Project Home, St. Elizabeth Recovery Residence, and Project Home, Hope Haven 2, Acts Christian Transitional Services, the Gordon Wright Community Development Center, Impact Services, Veterans, Housing and Employment, One Day at a Time, Sobriety Through Outpatient, and the Station House Apartments. Behavioral determinants of youth wellness. According to the Health Center Service Area Number 6 data, approximately 1/3 of adults and children are obese. Drug trafficking and violent crimes occur at disproportionate rates within the community. This community is also known for the open-air drug market and the population of drug-addicted people that move into the area. Lack of contraceptive use and unsafe sexual practices are common in this population, made evident by Hispanics having high rates of teen births, blacks or African Americans having high rates of teen gonorrhea and chlamydia and new HIV diagnosis. African Americans in Philadelphia are reported as having high rates of adult smoking, smoking deaths, and secondhand smoke exposure. Health system determinants of youth wellness. Local health care facilities include Temple's Episcopal Campus that includes a crisis response center and emergency trauma care, Esperanza Health Center, and several mental health facilities. Esperanza Health Center is known for its incorporation of culture and spirituality into medical practice. 15% of Philadelphians were reported as not having insurance in 2014. Santeria uses many forms of alternative healing, including staying connected with the Orishas. Orishas are spirits that reflect manifestations of supreme divinity, and the incorporation of herbs and healing. Santeria is a religion that is most often seen being practiced by Latinos in this community, as evidenced by the sales of paraphernalia in highly concentrated Latino areas. With a focus on spirituality and healing, the importance of science and evidence-based practice in Western medicine can create a barrier to care in the Hispanic population within the community. Determinants as related to childhood obesity within the Philadelphia, PA 19133 community. How do biology and genetics affect childhood obesity? Biological determinants of childhood obesity. Children born into a family with obese parents are more likely to be obese themselves. 56.9% of Black or African American and Hispanic women over the age of 20 are obese, and 37.6% of Black or African American and Hispanic men over the age of 20 are obese. Single gene mutations influence the development of severe childhood overweight. Childhood obesity affects roughly 12.7 million children and adolescents at 17%, with 21.9% of Hispanic youth and 19.5% of non-Hispanic, Black, or African American youth. How does the physical environment impact childhood obesity rates? The only supermarket in the Philadelphia, PA 19133 area is a Save-A-Lot that carries more packaged goods than fresh food and produce. Corner stores flood the neighborhood and can be found on almost every corner. These stores carry packaged processed foods, deli-style sandwiches, cooked fried foods, and very infrequently a handful of overpriced produce. There is a McDonald's, Burger King, Popeyes, Wendy's, and Dunkin' Donuts within the 1 square mile community. The unsafe environment creates a barrier to outdoor activity and exercise for the youth population. How does individual behavior affect childhood obesity? Children that live more sedentary lifestyles without adequate exercise and energy expenditure are at an increased risk for developing childhood obesity. Children are often provided with their meals and do not have much influence on the quality of the food they are consuming. Making healthy dietary decisions comes with several barriers, including access to fresh foods and the necessary income to build nutritious meals for entire families while living below the line of poverty. How does the socio-cultural environment affect childhood obesity in the community? Income, parental level of education, diet and lifestyle, and the built environment influence childhood obesity rates. Parental education levels and income are lower than national averages, increasing the risk for childhood obesity. Children with parents with less than 12 years of education had an obesity rate 3.1 times higher than those whose parents have a college degree. The median household income is under $20,000, with an unemployment rate of 7.54%. Poverty influences the quality of the meals being consumed. Children living in low-income neighborhoods are 20 to 60% more likely to be obese or overweight than children living in high socioeconomic status neighborhoods and healthier built environments. Almost half of the population within this community reports speaking Spanish at home. Cultural competence and sensitivity can influence the quality of care that members of this community receive. How does access to health care affect childhood obesity rates in the community? Through 2013, Blacks, Hispanics, and African and American Indians or Alaska Natives have continued to receive worse care for 40% of the quality measures assessed, and Asians receive worse care for 20% of measures. The development of a client-provider relationship is important when aiming to educate the client on pertinent health issues. Without the development of a trusting relationship, the client might believe that their best interest is not considered. Roughly 53% of uninsured children in the U.S. are Latino or African American, despite being eligible for Medicaid or CHIP. Primary nursing diagnosis. Ineffective health maintenance related to poor weight management, as evidenced by high rates of childhood obesity within the community. Nursing interventions. Primary intervention. Community outreach programs addressing all parents and children, but targeting the selected subpopulation and at-risk individuals through the use of affordable and free services and multilingual staff. Secondary intervention. Education on the importance of maintaining healthy weights and active lifestyles, and frequent free health screenings within the community. Tertiary intervention. Recreational centers will expand hours and have age-specific times slotted to ensure children are around age-appropriate crowds. Security checks and patrolling will take place to encourage a safe and friendly environment. Evaluation. New diagnoses of children of childhood obesity will decrease over a 5-year time frame.